Good afternoon, everyone. My name is Joey Zahner, and for today's webinar, we'll be going over the refugee health screening system in IRIS. If you have any questions as we go through, feel free to post those in the Q&A section of the Zoom meeting panel at the top or bottom of your screen, or you can use the chat functionality as well. And yeah, if you have any questions, feel free to post those throughout, and we'll get to those as they come in. And so hopefully you should be able to see my screen and hear me. If not, feel free to let me know. And it sounds like there's a lot of feedback. So if you're still having that issue, feel free to post that again. See if we can, hard to see on our end if there's any feedback here. Okay. Well, if you still are experiencing audio issues, feel free to let me know, and we'll look into that as to why that's happening. Okay, perfect. Looks like voice is clear, so we'll be good to go. Thank you for the update on that. So, perfect. Well, we'll go ahead and get started then. And so, if you do need access to the refugee training or the refugee module in IRIS, the way to go about getting access is going to the Forms tab at the top of the page in IRIS. And once you click on the Forms tab, the first form listed is called the IRIS Site Enrollment Form. And if you click on that, it should open up in a PDF. And what you'll do is fill this out, and even if you already use Iris or an administrative user, you can fill this out, or you need to fill this out again, this time specifically requesting the refugee health portion of the system. So the name or site of organization would be your clinic's name. Your VFC PIN would be needed if you are a Vaccines for Children provider. And then just include your address, phone, fax, email, and all of that information. The name of the primary contact / admin would be the person requesting the access to the refugee module, and the authorized representative would be the supervisor or the existing admin user at the facility. And then at the bottom portion of the page, there is a section for refugee health, and you can indicate to us whether you'd like the web entry user interface where you can actually record initial refugee health assessments results, or do the view only where you can just view the refugee health assessment. So you select either box depending on which one that you would like, and then sign at the bottom, and then at the top of the page you can see our fax number and email address of where to send a completed form to, and then we can go ahead and grant you access to the refugee health module. And so back in IRIS, if once you do have access, on the left-hand side of your screen, under Applications, you should see two links. You normally see IRIS, and now once you have access, you should see another one that says IRHAS. And when you click that, you'll come to the Iowa Refugee Health Assessment Screening Organization. And just like IRIS, once you click on that link, all the clinics that you have access to the refugee health assessment screening portion will be listed here. So you would click the blue clinic name link, and it will take you to the refugee screening. And so since our access is a little bit different, we'll go ahead and access through our training organization. And once you get to the training organization, or to your organization, on the left-hand side of your screen is going to be two sections for client and then query only. And so otherwise, it should look similar to IRIS. And then the kind of differentiate between the two, we do have the Iowa Refugee Health Program logo or placeholder there. So if you need to go ahead and complete the refugee health screening, what you want to do is click the Manage Client link on the left-hand side of your screen, or the Manage Refugee Screening. Both will take you to the search page, and where you can search for the patient that you need to conduct the screening for. Jessica will already put those patients in IRIS for you, so there's no need to really create a new record. They should already be in there for you. And if they are not, you can contact Jessica and she'll work with you on getting those added to the system. So we'll go ahead and pull up a patient example here. And so we clicked on Manage Refugee Screening and search for our patient, and that led us to our Refugee Health Screening Assessment Screening page. And at the top, there's 3 buttons: Save, Edit Client, and Immunization History. So what Save will do is save any changes that you're making on this page. If you do need to update the alien number or resettlement agency or anything like that, you can update that information and click on Save, and it'll go ahead and update the patient record. If you need to update their address, for example, you would click Edit Client, and that would take you to their patient demographic page where you can make changes to the patient record from there. And then if you need to view the patient's immunization history, you can do so by clicking that immunization history button, and it will take you to their immunization record. And then the personal information for the patient, their name, date of birth, and address/phone number will be listed. And then down below that, we have our refugee health information. So along with the patient already being an IRIS, so should the refugee health information. So these fields should already be completed for you. If not, though, it does allow you to do that, or you can work with Jessica to get those in there. But it does allow you to type in the refugee's alien number, and then the resettlement agency is the dropdown. There are 4 options that you can pick from the dropdown, or you can select other. And then if you do type select other, you can type in if other field if you need to do so. And then the alien status dropdown, you can see the various statuses we have for the patient. The arrival date will be in the month, day, and full year format. And then the registry status is going to be similar to IRIS in that you have active, inactive other, inactive MOGI, and inactive one-time only as far as the patient status for your clinic in IRIS. So we'll leave that as active. And then we have the nationality dropdown where you can go ahead and select that. Up until now, all the other fields have been required, but nationality and secondary migrant fields are optional. And for secondary migrant, you can select yes, no, or unknown. And then again, if you need to save any changes, what you can do is just click on the Save button, and then you'll get the message client updated at the top of the screen, and it should save any changes you made. And then after the refugee information, we do have our health assessment screening form. So what you can do is just click on the Collect Health Assessment Screening Data button. IRIS will open up in a new page, or the refugee health module will open up in a new page. And then it's going to go ahead and list the required fields on this page in blue and kind of go in specific sections. So here we have our information from the previous page, including the patient's information such as alien number, patient name, and other data. And then the first section, you can see the required fields are going to be in blue here. The screening date does default to today's date, but we did have a previous question on the webinar, previous webinar of can you change this to a previous date? So yes, it does default to today's date, but if you conducted the screening, last week or a couple days ago, you can change that screening date, and it allows you to type that in. And then you'll have, the provider name of the one and the screening site, phone number. And then we do have our required field of interpreter used, and it defaults to yes, or you can select no. And then the language spoken should be able to be picked from the drop-down list. And anytime throughout the screening, if you select the other from a drop-down list, this is a required field, so you will have to type in the other language, for example, that the patient may have spoke. So you won't be able to just select other without designating what that other value is. And then the next section down is the general health section. So we have information such as blood pressure, temperature, height, weight, all the way down to our required field of overseas medical review. And you can select whether that's not available or that you do have that. And then for allergies, we do have it defaulted select no known medical allergies. So you can leave it selected, or if you need to, you can select multiple ones under that field. So it does allow for multiple checkmark boxes to be selected if the patient has multiple allergies. Or if you select no known medical allergies, it will go ahead and default and pick that one. And again, if you do select other allergy, you would need to type in the other allergy that the patient has in order for it to be a completed form. The next section down is the TB screening required for patients 6 months and older. And the TB class status is a required field. It defaults to none, but you do have the option to select TB class A status and TB class B status. And then there's some other information to go along with the TB test that you can go ahead and complete. And then our next section down is the sexually transmitted diseases section. And there are 2 required fields in this one. Both are defaulted. So the syphilis RPR status defaults to not done. But if it has been completed, you can select the results from that dropdown. And then if you just select the referred to clinic, it's going to ask you to specify the physician/clinic. And again, if you select that option, you would need to type in that value in the field in order for you to save properly. And then the next section down is the HIV/AIDS status. That's a required field. Again, it defaults to not done, but you do have the ability to select negative or any other option from that drop-down list. And then there's the hepatitis screening section. So we do have 4 required fields, 3 of which are required for all ages. So each one is defaulted to not done. But if you had completed those screenings, you can go ahead and select that options of negative, positive, indeterminate, or results pending. And you can also leave them as not done, but if they have been completed, you want to complete those fields. The next section down is the intestinal parasite screening. So we have was the screening for parasites done? And that's a required field. It defaults to not screened for parasites, but again, we do have other options from that drop-down list. And then was CBC with differential done? It defaults to no, but you can select yes or if it was refused. The next section is malaria screening. Again, the required field was the screening for malaria done? You would be able to select not screened. That's the default option. Or if the screening did take place, you can select the available option from the drop-down. The next section down is the extended services lab. Here we have a required field of serum lead level. And again, that defaults to not done, but you can select the option from the drop-down. And we also have the urinalysis results of not done within normal limits or incomplete. And again, defaults to not done. And then we also have the complete metabolic profile, lipid profile, blood stool, and sickle cell testing. And those are all required fields, but they all default to not done. And then if there's any referrals that took place, you can select the checkmark box next to the referral. And then again, if you select other, it would be a field to go ahead and type in. And then if you've completed the screening, or if you need to come back to it, if you didn't get it all done, what you can do is from the Refugee Health Assessment Screening Status, if you click that, it is a required field. So if you've completed it, you can select the complete screening. But if you need to save and come back, what you can do is go ahead and select pending additional information or test results. Or there's 2 other options as well, of client lost to follow-up or client moved out of Iowa. But anytime you need to save your changes and come back, you can select pending additional information or test results, and you can click Save. And once you click on Save, it'll take you back to the patient demographic page here, and you can see the health assessment screening data is now down below. The status is pending, so that will let Jessica know that the health screening is in a pending status, so she'll be alerted to whether you need additional information or awaiting test results. And then the date link is the screening date. So whatever date you entered in the screening date field is going to be the name of the refugee screening document. And so you can see right now it's pending. If you go back and find any additional information and have time to complete it, you can just change that pending to completed screening, click Save, and now you can see our name changed, and it indicates to Jessica that the screening has been completed. If you need to review, again, you just click that date link and review any information or update it. And then if you need to print or print a restricted version, if you click Print Restricted, it'll go ahead and open up and allow you to print a version with some lesser details there, and you'll see their name, no address is on there, so it doesn't identify where the patient is. And then you can click File Print on that page, and it will print off for you, or click Print at the bottom of the screen there. And then if you click Print, you'll see this one will go ahead and have the address listed, I believe, or it doesn't seem to either on that one. So again, you can click File Print, or if you hover your mouse at the bottom of the Adobe, it should have a printer icon where you can print that. And then if you do need to navigate to the patient's immunization history, again, you can click the Immunization History button. You can see here their patient demographic information at the top and immunizations at the bottom. And so if you need to go back to the refugee screening after reviewing that, what you can do is click the Edit Patient button, which will take you back to the personal information section. And then there's a refugee screening button that takes you back to that screening page. Or you can research for the patient by going and clicking on the Manage Refugee Screening too. So there are ways to go back and forth in between the immunization part of it and the refugee screening portion as well. And then if you do have query-only access, what you can do is you'll click the View Refugee Screening link on the left-hand side of your screen. And again, search for that patient in IRIS. And here you should see all the same information, only it's not in editable format. So you'll see the patient's name and address. You also see their refugee information. And then if you need to, you'll see the completed screening. It doesn't allow you to edit, so that date link is not clickable. But you can click Print or Print Restricted and view that health screening. And then you can print that from there. And so that's the refugee screening module currently in IRIS. Jessica may speak to, in future releases of IRIS, we are hoping for some enhancements, such as refugee reports and refugee data exchange, so eliminate the need for any dual entry that you're currently doing. And those would be a future release of IRIS as a possible enhancement that we'll be making in the future there. So if you have any questions, feel free to post those in the Q&A section or the chat, and we can answer those as they come in, and Jessica can add some more information as well. So feel free to post your questions.
All right, good afternoon. This is Jessica Schultz. I'm the Refugee Health Coordinator. So as Joey said, we are currently working with the vendor to get data exchange in the future, but right now that's not possible, but we're going to have that at a later date, and we'll let you know when that happens. At the last webinar, we did have a question about, are you required to do both the paper-based refugee health assessment screening submission and IRIS? And we said no, that it's not required to do both. We will still accept the paper copies, but our preference would be to move forward to use the IRIS, the module to collect the data. If you are interested, I would be happy to review any entries that you make in the Refugee Health Assessment Screening module and compare them to a paper form and give feedback. So you can send me an email or call me by my office number. It's 515-281-0433. We will be posting this webinar, the one that we had last week, to our website. So if there's someone in your office that was not able to attend either webinar, you can watch it at a future date. And I'll send out when that has been posted. And then just moving forward, if you have any questions about getting access to the module, please contact the IRIS Help Desk. That number should be on the IRIS website, but just in case you don't have it, it's 1-800-374-3958. And then if you have specific questions about the initial health assessment, any of the variables that are entered, or as Joey mentioned, if you've had questions finding a patient, or if there's some sort of issue there, you can always give me a call or send me an email. Again, my office is 515-281-0433. I think we've not received any questions yet, so we still have a little bit of time if you do have any more questions, or you can send me an email offline if that's more comfortable for you. I think we'll give it a couple more minutes if you have any questions. Oh, I think we just got one. If we already have an IRIS access, do we need to complete a new site agreement form? I'm going to have Joey answer that.
And the answer to that is yes, you would need to complete a new form. And that's for our record keeping purposes. We need to know, have the paperwork of who needs what access. And so even if you've already completed that site enrollment form, we would need you to complete that again. Only this time, you just fill that out, and then just under planned use of IRIS, you can complete the immunization portion too. That would be helpful, but we can already see that you already have access to IRIS. So the main thing you want to do is fill out the refugee health module portion, whether you need the web entry, the ability to enter those in, or if you just need to view them. So yeah, we wouldn't, your username and password and 5-digit OR code all stay the exact same. The only difference is when you log into IRIS initially after submitting this form and we grant you the access, is going to be on the left-hand side of your screen. Under applications, you'll see IRIS and then IRHAS. And so again, IRIS would be the immunization portion, IRHS would be the refugee health portion, and you should see a blue clinic name there for depending on which one you enter. But we do need that form filled out for record keeping purposes so we know who has access to what. So thank you for that question. If you have a follow-up or have any others, feel free to let us know. Perfect. And I'm glad, very exciting for you guys as well. So, and hopefully with the future enhancements too, with the reports and electronic exchange will help in the future as well. Well, it doesn't look like we have any other questions. If you do think of any in the meantime, feel free to let Jessica or the IRIS Help Desk know, and we'd be happy to answer any questions that you guys have. And then this module is available on IRIS now, so as soon as you request it with that form, we do process those in a couple business days and can grant you access to that. So feel free to, again, to let us know if you have any questions. Thank you for taking time for today's webinar, and have a good rest of your day.